we are going to see about the entirely sensory second division of the trigeminal nerve, that is the maxillary nerve. It supplies the derivatives of the maxillary process and then later transgresses the adjoining territory of the frontonasal process. Before going into the details of the maxillary nerve, let's get oriented with this diagram. This region is the middle cranial fossa, and this foramen will be the foramen rotunda. This region will be the pterygopalatine fossa. This will be the orbit, and this region will be the floor of the orbit. This is the region where a part of the maxillary bone is removed to show the mucoperiosteum of the maxillary sinus. Then this is the face region. So this will be the infraorbital foramen. Let's start with the course of the maxillary nerve. So the maxillary nerve, it arises from the convex anterior border of the trigeminal ganglion. It passes forwards in the middle cranial fossa within the lateral wall of the cavernous sinus, and it leaves the skull through the foramen rotunda, which lies over here. Then it reaches the pterygopalatine fossa. It goes through the upper part of the pterygopalatine fossa. This will be the pterygopalatine fossa, and the nerve coursing through the upper part. And then it lodges in a groove on the posterior surface of the body of the maxilla, in the upper part of the posterior surface of the body of the maxilla, to enter into a groove over this region, that is the infraorbital fissure, inferior orbital fissure. So from here onwards, you can call this nerve as the infraorbital nerve. Then, while in the pterygopalatine fossa, this pterygopalatine ganglion, which is a nodular structure appearing in this region, will be hanging from the maxillary nerve by two roots. Then the infraorbital nerve runs forward along the floor of the orbit in the infraorbital groove. Then it passes through a canal in the floor of the orbit, that is the infraorbital canal, and appears in the face through the inferior orbital foramen or the infraorbital foramen to the below the origin of the levator labii superioris. Let's see the branches of the maxillary nerve. The branches of the maxillary nerve was divided in the, what are the branches in the middle cranial fossa, what are the branches in the pterygopalatine fossa, and what are the branches in the infraorbital canal, and what are the branches in the face. Like this we have to divide and learn. So the first, in the middle cranial fossa, you can see a small twig of nerve arising from here, that is the meningeal branch, that is going to supply the dura of the middle cranial fossa. In the pterygopalatine fossa, three groups of branches arise. First one, that is the ganglionic branches towards the pterygopalatine ganglion. Next one, the zygomatic nerve, which passes towards the zygomatic foramen. Then the posterior superior alveolar nerve here. Let's see one by one. So the ganglionic branches, they are two in number. They suspend the pterygopalatine ganglion from the maxillary nerve. Next one is the zygomatic nerve. This zygomatic nerve comes and divides into a zygomatico-facial branch and a zygomatico-temporal branch. The zygomatico-facial nerve, they appear in the face through a foramen in the zygomatic bone. This is the cut section of the zygomatic bone. So the zygomatico-facial nerve appears in the face through a foramen in the zygomatic bone and supplies the skin on the prominence of the cheek, while the zygomatic-temporal nerve, they passes along the infralateral wall of the orbit and they appear in the temporal region through a foramen in the zygomatic bone, which is shown over here. Then it pierces the temporal fascia above 2 centimeters above the zygomatic arch, then supplies the skin of the temporal region. The interesting point is, here you can see a connection with some another nerve. This nerve is the nerve that is going to the lacrimal gland over here. So this will be the lacrimal nerve. So there is a communication between the zygomatic-temporal nerve and the lacrimal nerve to carry the parasympathetic information from the pterygopalatine ganglion to the lacrimal gland through this part. Next branch is the posterior superior alveolar nerve, or otherwise known as the dental nerve. It enters through one or more foramina on the posterior surface of the body of the axilla. This is the posterior surface of the body of the axilla. It enters through there. Then what happens? It supplies you can trace the nerve to this region. So it comes here and it supplies the mucous membrane of the maxillary sinus in this region. This is shown in a different color, and this nerve is going to supply over here and then breaks up to form the superior dental plexus. This region will be the superior dental plexus to supply the molar tooth and the adjoining gum of the upper jaw. This will be the molar tooth and the adjoining gum of the upper jaw. That was all about the branches in the pterygopalatine fossa. Let's see the branches in the infraorbital canal. That's from here to this region till the opening of the infraorbital foramen. So the first branch will be the middle superior alveolar nerve, which is shown over here through this branch. The middle superior alveolar nerve. It passes downward along the lateral wall of the maxillary sinus, joins with the superior dental plexus and supplies the premolar tooth. Next branch is the anterior superior alveolar nerve, that is this branch. Anterior superior alveolar nerve. It passes downward and medially below the infraorbital foramen in the anterior wall of the maxillary sinus. This is the maxillary sinus and this is the anterior wall. So it passes through a infraorbital canal below the infraorbital foramen. That is the canalis sinuosus. This is the canalis sinuosus and divides into dental and nasal branches. That was about the branches in the infraorbital canal. Now the last part, the branches on the face. They are the palpebral branches. They appear upwards. They turn upwards, pierce the orbicularis oculi and supplies the skin of the lower eyelid. Next one is the nasal branches. The nasal branches, they supply the skin of the side of the nose and the mobile part of the nasal septum. Next branch are the superior labial branches. They join with the branches of the facial nerve and form the infraorbital plexus.